Thank you so much, Mr. Gaylor, for honoring us with that beautiful thing. I'm so happy to be here today. My name is Jamuna. I'm a therapist and well-being specialist in the Resiliency Center here at the University of Utah. I'd like to introduce my colleague, Dr. Jake Van Epps, who is also a therapist in the Resiliency Center. We want to thank Dr. Leisher and her wonderful team for inviting us to this opportunity to be with you all today. Today, we are going to be talking for a few minutes on fostering a culture of wellness. This is a really painful, difficult topic that we're here to discuss today. We want to encourage you to really take care of yourself in whatever way that feels right to you today.
So right from the beginning of the planning of this conference, it was requested that it be framed from a perspective of taking care of yourself and taking care of each other to do this work and to make it more meaningful. And we work at the Resiliency Center, and so it sounds a little bit cheesy, but we did want to present on the concept of resilience. According to this definition, we're kind of focusing in on the second definition. Resilience is growth that's achieved by learning through a difficult experience. That's represented in this graph. We are going through our daily lives, functioning as we normally do, and then we get hit by big incidences that have a big impact on us. And it's hurt and we struggle and we get through it. But if we're learning through the process and we're intentional about taking that learning and doing something with it, then we come out on the other side stronger and more resilient.
We often think about injury as something physical, something that we can actually see. But the more research that has been done on stress, we know that stress can have a significant impact on our bodies and also, of course, psychologically. So we want you to think about stress as actually being an injury. So there's 4 different types of stress injuries that can happen to us. The first is trauma. This is, of course, traumatic childbirth. This impacts everybody involved. This obviously involves the family. This involves the providers, healthcare staff. And we also know from the literature that trauma literally stores in our bodies, and very, very important to be able to address that. The second is loss. Grief and loss is considered an injury. And we know from the literature that healing is not linear. We know about the different stages of grief. We don't necessarily go through each of them in a linear fashion. We can go all the way to even acceptance and go right back to sadness again. And so being able to recognize loss as an injury. The third is moral injury. And this is when we are witnessing the behaviors of people that are not engaging in behaviors that are aligning with our values. So think about being treated with disrespect, right, by a healthcare provider. Racism, sexism, all of the isms is considered a moral injury. And then also moral injury can show up as not having the desired outcome that we were planning. And then lastly is wear and tear. And this is when we are getting hit from stress from all over without sufficient time to recover and heal. This is one of my favorite Khalil Gibran quotes. Out of the suffering have emerged the strongest souls. The most massive characters are seared with scars. We'd like to introduce to you a framework to be thinking about as we're going through this day for recovery and healing.
So the framework that we're proposing for today, we refer to it as the 3 R's. It stands for recognize, recover, rebuild. Recognize is really just acknowledging what you've been through, checking in on how you're doing, noticing how much you've accomplished even sometimes. But it's important to kind of notice when we have these stress injuries, when we have this impact, because if we don't recognize it, if we don't honor it the way that it deserves, then we're not going to be intentional about taking steps to address it and to try to recover. Recovering is carving out time. When we go through an emotionally difficult process, people don't tend to give it enough credit, how much energy it takes, how much time it takes, how much of your attentional and cognitive functioning it takes. And so we need to carve out time to give ourselves permission to go through it. We need to identify what feeds ourselves intrinsically and develop interventions that promote well-being. And lastly, when we reflect on those experiences, when we try to learn from that experience, we can take that learning and use that to rebuild a stronger future. We can identify the parts of our old normal that weren't working. We can take action to create healthier, more sustainable, and equitable futures. Dr. Vivek Murthy is the US Surgeon General, and he was also the US Surgeon General under the Obama administration. His number one kind of public health focus, his personal passion, has been combating chronic loneliness. And why is that? It sounds like an awfully fluffy subject for a US Surgeon General to be focusing on from a public health perspective, but that's because the research is really clear. When folks who are chronically lonely have the same decreased mortality as smoking 15 or more cigarettes a day, has worse health outcomes than obesity or excessive alcohol consumption. So not only does it have as bad, if not worse, outcomes than all those other leading health indicators, it's also more prevalent in society. So really, and we see this every day on a personal level, healing comes through community. It comes through connection. And so, bringing this diverse group of folks together, researchers, caregivers, parents and family, and working together to try to address these gaps in access to care is such a beautiful way to promote healing connection.
And so in front of you, you each have a Post-it notepad. We're going to be doing a note card activity today. So each of the three R's are going to be on flip charts at the two stations in the back of the room. We really encourage you to reflect on the 3R processes and write things down that are coming up for you today that feel true to you. We're going to then post the notes on the appropriate stations or the appropriate pads across the room. And for the rebuild sticky notes, reflect on ways to close the gaps on stillbirth and care. So some questions that you may want to consider for the flip chart. Recognize, acknowledge what you've been through, validate how you're feeling, validate your own feelings, very important. Recognize what experiences made it more difficult. Recovery, what do you need to recover? What has helped in the past? And then rebuild, what has been missing? What did you learn for next time? And then also, how do we close the gap on stillbirth prevention and care? Dr. Leisha is going to kind of remind you about these different instructions a little bit later. But we also encourage you, if you'd like to take a picture of these questions, so you can have them fresh in your mind. Oh, sorry, I didn't mean to do that. Sorry. So I'll give you just a second to take a picture.